Shaving down a pre-ulcerative lesion to prevent ulceration. Okay, I'm the famous Dr. Levy, foot doctor, famous in New York. No, I'm just kidding. Then now I'll be famous in India, I guess.
Yeah.
Okay, so we just shave off all this dead skin slowly. We don't want to open up anymore, but by doing this, it will prevent excess pressure, and it will prevent ulcerations from forming, because you could get a diabetic pressure ulcer, especially with patients with neuropathy. So that's why your father's getting this. He doesn't feel his feet. You know that, right?
Right.
And when you don't feel anything and the callus builds up, eventually it breaks down the tissue underneath.
Oh, okay.
And unfortunately, too, did you have an infection here before?
No.
No, but he has no fat pad at all. There's no fat under here.
Oh, okay.
And that becomes a problem, too, because if there's no fat and regular padding in your foot,
Right.
sometimes it could bleed a little. That's fine. Nothing to worry about. As long as there's blood, we're happy. If there's no cushion, then it's just too much pressure and the foot can't take it. So you can see now it's all down, and he still has a teeny wound right in the middle,
Right.
which we'll shave down. And getting it to bleed is not a bad thing. That actually promotes healing. But he's pretty much healed already. He's got another week, he'll be healed.
Okay.
This has to be done pretty routinely. And even if you use like a pumice stone yourself, I mean, you have to be very careful. No blades, but at least some kind of nail file or something to keep some of that tissue down every other day. Because look, it's right on bone.
Bone, yeah.
Yeah, I mean, the real cure, if it keeps... I mean, the real cure, eventually you may just want me to file down that bone.
Yeah.
And then you won't have to deal with this ever again in your life. So, but I'll just cover that up. We'll give you some... I'm just going to put silver nitrate. That'll cauterize it. Cauterize the bleeding. And then we'll give you some padding to take. When are you leaving?
Maybe next week.
Next week, okay.
10, 15 days. Maybe 10, 15 days.
Right now you don't have to put a big bulky dressing because I just cauterized it. I mean, there's still a little wound, but another week you'll be fine once this callus covers it. But don't blow this off for 3 months or you're going to get another wound again. All you have to do is shave down the callus every few weeks and you'll never get a wound.
Now, shaving out this callus, you need some particular kind of blade? Or
well, there's a 50. I use a number 15 scalpel. You could use a number 10.
that could be obtained at a pharmacy, or
No, well,
usually can I get it from you?
Well, no, I wouldn't give you scalpel blades.
Okay.
I just said you shouldn't use a blade on your foot. You should he should use a pumice stone.
Okay.
A stone to rub it, or a file.
Filer, okay.
He's not going to feel if he pokes his... If the blade will go through this side of the foot, he won't know it.
Oh, no.
Yeah, so if a doctor wants to use their scalpel blades and do it for you every month in India...
Yeah, for the doctor.
Yeah, or someone professional that could do that.
Yeah.
But you should never...